afternoon, everyone. Thank you for joining us. I'm going to start and just set the stage briefly. We're going to be talking about women's place in the COVID economic recovery, and you don't have to read very far in the newspaper to know that women have been hit particularly hard during COVID. If you look at the overall job numbers in California, between February and September, California lost 1.6 million jobs, which is down from the 2.6 million in March and April across men and women. But if you look at February 2020, women were 45% of the workforce and have experienced 53% of the job losses. So the job losses have disproportionately hit women. Nationally, 5.3 million jobs have been lost for women as of the end of January. And just in December, 86% of all the jobs that were lost by women. So the question is really, I think, to frame our conversation for today is, what accounts for that? Certainly, job loss has been in industries that disproportionately employ women. We call these the close contact industries: services, hospitality, food, arts and entertainment, personal care. 1 in 4 women work in one of these close contact industries, and they've experienced between 20 and 44% of loss of employment. Second factor important to consider is that essential workers are disproportionately women. So women are on the front lines. They are often low wage workers. 1 in 3 women could be classified as an essential worker. And here we have healthcare, retail, grocery workers. And the third factor I think important to mention is that caregiving disproportionately falls to women as well. This has forced women to cut back on their hours, to leave the workforce at higher rates. So all of the unpaid work of childcare and elder care, often done by women. 1/3 of the households in the nation have children. 1/4 are caring for elderly family members. And when the pandemic hit and the loss of social support became clear, public resources closed, we lost schools. And so all of the resources that we rely on to manage work and family as women, all those resources disappeared. And as a result, women left the workforce entirely at much higher rates, as well as cut back on their hours. Nationally, 2.3 million women left the workforce altogether. In women's employment is at 57%, the lowest rate since 1988. And what that means is these women don't even count any longer as unemployed because they're no longer looking for work. Now, of course, not all of this is due to caregiving, but research shows this is a very significant factor in women's retreat from the workforce. And there's an economic cost not only for today in terms of income, but long-term as well. So the lost income, income growth, the difficulty of returning to the labor market, all issues that I hope we will talk about today. Also important to note that these effects are not only disproportionately to women, but disproportionately women of color. The unemployment rate has been higher for women of color. So right now, if the overall employment rate is 6.3%, much better than the 16% it was in April. But Latino women are at 8.8% relative to that 6.3%. Black women at 8.5%, Asian women at 7.9%. So disproportionately affecting women of color. And the Latinx population in particular. They're 38% of the overall workforce in California, but have experienced 50% of the job loss. Big tolls here also in terms of caregiving, right? People of color are taking care of people that are sicker because of the systemic issues in our society, increasing not only their exposure to COVID, but extending the length of time and the amount of time that they just need to spend in that unpaid caregiving work. So a lot for us to be talking about today. I'm pleased to introduce Alex Cohen, who's going to be our moderator for today. Alex is the host of Inside the Issues and the podcast SoCal in 17 on Spectrum News 1. After a long career at NPR, she joined as an anchor at Spectrum in 2018. She's a longtime resident of Los Angeles, and if you you do that QR code that Harley mentioned at the beginning, you can read some very fun facts about Alex in the digital program. So thank you, Alex, for moderating. I will turn it over to you now.
Thank you so much, Professor. I really appreciate it. And I think, honestly, the most important part of my CV as it pertains to today's event is the fact that I am a working mother. So especially when you talk about that caregiving aspect, I know exactly what that is all about. We are so fortunate today to have a number of really great panelists, and I'd like to introduce them a bit more thoroughly now, starting off with State Senator Nancy Skinner, who is chair of the Senate Budget and Fiscal Review Committee, also vice chair of the Legislative Women's Caucus. We know how busy you are right now, so we're so glad to have you with us. We also have Dee Dee Myers, senior advisor to Governor Gavin Newsom, another phenomenally busy woman. Dee Dee Myers, also director of the Governor's Office of Business and Economic Development. And we also have with us Odilia Romero, who is co-founder and executive director of a group here in Southern California known as CIELO. And finally, Christine Beckman, who we just heard from there, Price Family Chair in Social Innovation and professor at USC Price School of Public Policy. And I have been thinking about today's subject and certainly so many of the issues that Professor Beckman just brought up. And I was thinking maybe because so much of this, to me at least as a woman, is so disheartening and so depressing that I thought maybe we could almost try to start off with a bit of levity and a bit of fun. Professor Beckman just kind of outlined some of the factors that are most affecting women right now in the midst of this pandemic. If we all hopefully remember that old school game show Family Feud, right, where the host would say, okay, let's throw them up and see if it's there on the board. And we just heard some of them, but let's talk about some. Maybe we could go first. Let's Dee Dee Myers, let's go to you. Okay, let's get another factor up there on the board. What is affecting women that may not be affecting men or affecting in a different way when it comes to the workforce, the economy in the midst of this pandemic?
Well, I think that Christine laid out in great detail so many of the factors that are affecting women. But one that we didn't talk about is access to capital, right? Women small business owners have struggled. Small businesses across California have struggled. Senator Skinner certainly knows this. And one of the things that businesses do in times of trouble is they go get access to capital to support their businesses and bridge them across the divide. And that's an ongoing problem, not just one of the pandemic, but one of the many challenges that face women. And I think, Christine laid out so many of the others, the disproportionate, burden of caring for children, although that's not always a burden, but also other family members, being in high risk industries, being in high risk sectors, all of the things that make it complicated. But there's one other thing, and Christine, maybe at some point your institute can study this. The death rate for women is lower in spite of all the exposure. And I wonder if it's because women are just more careful. They have too many people to care for. They can't risk taking unnecessary risks. And so they have died at substantially, although too many people have died, women have died at lower rates. And I find that interesting.
Yeah. And maybe this would be a good point. We can turn next to Odilia Romero, because although that is true, very much so, that women across the board have had lower death rates, what we do know, and we've certainly seen it here in Southern California, just the huge disparity racially and ethnically in terms of who is getting COVID-19, who's getting really sick from it, who is dying, and who is not getting the vaccines, which I think really plays into this too. And Odilia, I saw you tweeting about this just last night. Do you maybe care to pick it up from here and talk about some of the unique circumstances that women of color here are facing right now?
Well, but thank you for having me. This is very exciting. And, for me, for us as Indigenous people here in LA, we are labeled as Latinx. So there's actually no numbers of how many of us have passed away, being men or women. But when I'm thinking right now, true, most of the men have passed away. Very few women have passed away of COVID in our communities. I mean, the population's large. We don't have exact numbers. Like every time I look at the numbers when LA County Health Department puts it up on tweet, I'm like, I knew 3 people that died of COVID that were in Latinx. I know 5 people these days, depending on the day. I know of the people that die. So yes, it has affected us disproportionately. COVID, most of us are in the service sector. As the closure of restaurants, a lot of the women became unemployed. Some of the stories we hear from the communities, because they are, a lot of them are domestic workers. They lost their job because they weren't able to, a lot of them travel by bus too. So one of the requirements from their employer was you either drive or you don't have a job. And then in that case, do you have a vaccine? You could come, or if you don't have a vaccine, you can't come. So right now they don't have access to the vaccine, right? So because they're not in that phase. So there's a lot of challenges. But one thing that does really impact us a lot is the fact that we're labeled as Latinx. So there's no numbers. We don't exist.
Yeah. Senator Skinner, I think this is a great point to bring you into the conversation. And I do want to say we were just talking about this on our program, because I have been trying to get vaccination appointments for the child care workers at my son's school. And so I know I've actually become very familiar with the My Turn website. And I do want to give kudos, especially when it comes to gender. If you are able to get an appointment, you actually go through at a certain point when you fill out that part, it asks male, female, other, non-binary, and I have a feeling you don't see that in other states outside of California, so kudos on that. But to Odilia's point of really trying to accurately track the data of all the many women and many kinds of women in this state, can you talk about some of the challenges there that we face right now?
So you made a great point. California does well. We recognize that we're a very diverse state, and there's that diversity goes across many. It's not just a diversity of ethnicity, but also a diversity of our self-identification. But let's go back to this issue of, what's happened to women and why women have died less. Or look, when we talk about women dying less, we still, and it's already been acknowledged, that women of color have died more. White women have died far less. Women overall died less. But, part of me, I almost joked in my head, and that was referenced because I thought, of course we died less. It's not just that we're more careful, because we've always borne the burden more. And so, now we're bearing even more burden, and we handle it. We handle it. We always have, and we will. And, men don't. And if you look just what's happened now, it's that domestic labor, which has always been either non-valued or undervalued in our society. We've just hit it right in the head, because those women that were paid by others for domestic labor had the worst pay, and that domestic labor, all of those jobs went away. And then the rest of us who still had jobs, all of a sudden we had to do all that domestic labor. And so for many of us, we chose to stay home. But why did we choose to stay home versus the man in the household? Because we were paid less in the first place. So when we thought about, oh, heck, all of a sudden now there's all this burden of this unpaid domestic labor, which one of us will stay home? Well, of course, it makes sense for the one who's paid better to not. So, and men are paid better. So there's so many ways in which our economy, the pandemic exposed all of these structural issues that are there regardless of the pandemic, but for the pandemic made it far worse and turned it into a she session.
Yeah, preach it, Senator Skinner. Yes, absolutely. I just have to say, we have this conversation in my household all the time, where I really love to think, and my husband is a wonderful partner and a great help, and I like to think that we move beyond those gender norms, but guess who does the cooking? And guess who shops for the food? And, all of that stuff. And I know I am not the only one.
Run Zoom school at home.
Oh, yes, right. So, Professor Beckman, can we bring you in on this? Because I feel like, remember those old Virginia Slims ads, you've come a long way, baby. And I feel like this pandemic has really set us back. Is there, in terms of those gender norms, Professor Beckman, maybe you can talk a little bit to what can just even on a day-to-day basis for all women, regardless of whatever their situation is, to kind of not fall back into? Because I feel like there is this kind of assumption about, if it's something related to taking care of children, well, then that becomes the woman's job in the household. How do we break out of this kind of norm?
Right. And if a pandemic's not going to do it, what is, right? I mean, I know that this level of crisis that families are experiencing. So I have a book that came out in June called Dreams of the Overworked, where we looked at 9 different families, and we're talking about, you know, how people juggled and yeah, so these problems have been here, right? They were here before the pandemic. It's just the pandemic sort of made them very clear how much we relied on other women that were lower paid, right? The way I was able to succeed in the workplace was by relying on other people to help me, because, and it wasn't my husband, right? It was other women that were helping. So in the book, we talk about sort of the invisible work. And I think this is a simple thing, but really just labeling all of the things that we do. And it's not just the physical work of cooking and laundry, but it's also the mental work of tracking what needs to get done, who needs a doctor's appointment. It's also the coordinating work of who needs to be where, you know. So in my family, I would say the pandemic has been a time where that language has been really popular would suggest that my husband and children like this language, which I'm not sure they do, but they really get it now. And so that being able to just sort of articulate it, because it is invisible. We call it invisible work. It's unseen, low paid or unpaid. And unless we really articulate it, it's just so easy for people to not see it and not call it out. So that'd be one thing I would say. But really, I think this is not an individual problem. It's not a family problem. It's a society problem. And really what we need is better infrastructure and better support, better childcare, you know, more leave, like all of the things that Senator Skinner is, you know, working on to really make it so that we don't have to have this an argument in the household, that there is just the support available for everyone.
Yeah. And I think a big part of that, and hopefully we'll have a good chance to talk about this from many different angles, is women helping other women. And Odilia, I'm hoping we can go back to you, and maybe you can tell us a little bit about the work that you've been doing there throughout this pandemic at CIELO to try to help out other Indigenous women here in Southern California.
Well, I'm excited to share CIELO is the first women-led organization in LA County, Indigenous-led organization, but also founded by Indigenous women. And we've been here for 5 years, but when the pandemic hit, we sat there for a moment and said, what are we gonna do? Like, where are we gonna get money? Because at that time we had like $5,000 of money in our budget. I mean, and then people started calling, do you guys know of any work? Do you know of any place that is hiring? I've been fired because I'm traveling on the bus. So we decided to make a call and say, hey, we want to start an undocumented Indigenous fund. And a woman in Nevada donated $5,000 and then 7th generation, $10,000. And we started with $25,000 and we cut checks of $400 each. And we're like, that's as much as we could do. Like, who's going to give us money? Like, one, because on Indigenous women-led organization, there isn't that many, but also Indigenous organizations in general are underfunded, right? Suddenly, LA Times picked up the $25,000 fund, and one day we got a call, are you able to handle $200,000? We said, what, $200,000? That's a lot of money. And then another call, here goes $400,000. Here goes another $4,100. So we got $1.5 million of the first phase of our undocumented Indigenous fund. Most of the people that received the fund were restaurant workers and domestic workers in LA County. These are the first numbers that exist of the languages, what industry they work in, because we work very closely with the hometown associations of Indigenous people in LA, but we had no numbers. So now we have a map that we're going to launch very soon that tells you where do they live, what languages are spoken, what industry are they in. So this is for us very exciting because with this map, we were able to go to LA County and say, we need to be part of the campaign for vaccination. And every institution, government institution asks for numbers. And here are our first numbers. We exist. For us, it's just the acknowledgement of our existence through numbers, because without numbers, we're not here, we don't live. So far we've been able to help with $1.5 million. We were able to first time partner with LA County with the food vouchers, Let's Feed LA, we were able to provide $1.8 million to Indigenous households in LA County. And we were also started a food pantry program. And now we partner with World Harvest, where people could go and shop for whatever they need. Some of the things that we learned through the app that we work with LA County, they were in culturally relevant to food. So we partner with this market, and now we're fundraising. We're also with the vaccine campaign, and it has been very challenging because they're not in that phase. So they're asking for 65 plus. We don't have that many people 65 plus. We have workers from 40 to 64 and 12 months. So they don't qualify. And it's been very challenging. Like they've gone. So we're helping them book the appointments, and we have interpreters helping them go through the whole process in 3 different variants of Zapotec. I myself help sometimes with the process because of the variant I speak in Quiche and Mije. So we are like at the front lines right now with Indigenous communities, and they're calling like, if I could get this vaccine, I could get back to work. And we're like, but you're not in the phase, So we are in. But we're trying our best to support as many people as we can. I will share the report of the Undocumented Indigenous Fund, and it will tell you that in LA County, there's 18 Indigenous languages spoken. So this is really exciting. I'll share the report with all of you, and but yeah.
Yeah. And we are seeing every day, day by day, more and more of an opening up. Come the middle of the month at March 15th, people with underlying conditions, even if they are younger than 65, hopefully as more supply happens, that will help address it. I want to move and start incorporating some of the questions that we've received from our audience. One asking about a particular industry which has been particularly hard hit, which is run often by women. And I'm talking about the childcare business. And one of our audience members asked today, significant numbers of businesses owned by women of color are childcare businesses, and these have suffered during the pandemic. Can you talk about this issue? Women business owners and women employees are both hurt when such businesses fail. Dee Dee Myers, do you want to take that one on?
Sure, it's absolutely correct. Women-owned businesses have been particularly hard hit for a lot of reasons, small businesses in general as a category, but women-owned businesses, not only in childcare, but also in cosmetology, nail salons, restaurants. Those are all among the most heavily impacted, and childcare being certainly one of them. So the state's taken, and Governor Newsom has taken a number of steps working in partnership with the legislature, and thank you, Senator Skinner, for your support to stand up a number of programs. Most importantly, a small business relief grant program that is a grant. Some of you may have seen it. We started out with $500 million in grants last year. And through the application process, we got 350,000 applications, which shows you the depth of the need for what turned out to be about 40,000 grants. We, with the work contribution of the legislature, now have $2 billion more dollars and to provide additional grants to small businesses. And many of those are women-owned business. Half of the recipients are women-owned businesses in the first couple of rounds, and we are targeting the grants to those industries that have been hardest hit, and so many women will benefit from that. There are also some fee relief programs, and again, directed toward cosmetology and restaurants and other places where fee relief can help businesses get through the next months as we go forward. But again, and I think the longer term access to capital, women just have not had access to capital, so they haven't always had the reserves that they need to get through the tough times. And so we will continue to reach out to women-owned businesses. We'll continue to make sure they know some of these grants, tax relief programs, and other subsidies are available. There are additional funds, and Senator Skinner can probably talk more about it, in the budget directed directly toward childcare and schools to get people back to work in those hard-hit industries. And so there's more need than there are resources, but we will keep trying to make sure we get the resources to the women who need it and get those businesses back up on their feet. Because not only are the proprietors women, they hire a lot of women, and small businesses are the biggest private sector employer in the state. There's 4 million of them, and they're key and critical to the recovery of our economy.
And Senator Skinner, I would like to turn to you, and if folks in the audience are not familiar with this, there have been some very big developments this week with you, your colleagues there in the legislature, and Governor Gavin Newsom announcing a deal to try to provide incentives for schools to reopen. I feel like the schools reopening, it has become one of the biggest, most hot button issues in the state right now, and I imagine a tricky one to address as an elected official, because here is one. I mean, there are so many things where all of us as women share very much the same situation. It seems like the school situation is particularly difficult because on the one hand, you have women, working mothers, especially as Gavin Newsom did earlier this week, giving a shout out to single mothers who are balancing so much on their shoulders right now, so many of them desperate for schools to reopen. On the other hand, how many women are teachers in those classrooms, school nurses, librarians, bus drivers, custodians, right? And they want to be safe. So it feels like here we are with women who all have very legitimate, very important needs to be met, but sometimes those needs may be seen as being at cross purposes. So can you kind of talk to us about how you are trying to navigate what are really uncharted waters?
First, on the small business thing, I'm so proud that we were able to put $2 billion additional dollars into a small business grant fund. And as Dee Dee pointed out, it is targeted for minority-owned business, women-owned businesses, very small businesses who have not been helped by pandemic relief from the feds and such. But on this issue of schools, so our schools have been providing education online. For many kids, for many families, it's inadequate for so many reasons, and I don't have to go into them. So what we've been focused on and what we just voted on this morning in the state Senate, and I believe in the state assembly, was a path to get kids back in the classroom for in-person instruction. But we talk about just the single mothers. No, it's not just single mothers. Any family has been burdened in effect by their child having to be home. But there's also as many families, as many parents that want their kids back in that classroom. There are just as many who are afraid. No one in their right mind wants COVID. And that virus is still rampant in our communities. And, you know, CDC may indicate there's little transmission amongst kids. If you bring a whole bunch of people back into an indoor environment, look at what's happening in the gyms. You can spread COVID unless you have absolutely done it in the safest way. So to give even the families the confidence that they could send their children back and be in person, we had to create a plan that would really give schools the adequate funding to put in the safety measures and to give the staff and the teachers access to vaccines. We don't require the vaccines, but we're giving access. And Governor Newsom did a great thing by dedicating 10% of the supply of vaccines from this point on to our teachers and our school staff. And then parents can feel confident that they can send their kids back into the classroom and feel safe.
We are about halfway through our discussion today, so I want to try to turn us towards, you know, the title of this whole session about how do we keep women as part of this recovery process. And Professor Beckman, maybe you can describe for us some of the ways that when we do talk about rebuilding, when we talk about bringing kids back to school, bringing people back to work, how can we do so in such a way to really ensure that women, our needs, our goals are met in this process?
Wow, it's a big question, Alex. So I think that, I think the care work is essential, right? And sort of building that infrastructure and really, and that's not a short run solution. That's a long run solution. And I saw this in one of the questions, but I don't think we can ignore if we don't use this as a moment to really jumpstart some of those efforts, it will be really a tragedy, even more of a tragedy than we've already been in, because these are problems that are just, we're going to, you know, kids are going to go back to school and that's going to be great, but school is still going to end at 3. And women, you know, people still work until past 3. So we have a structural problem that we need to address. And I guess the other thing is the policies that we do put in place. So California's got some wonderful policies, unlike many other states, like the paid parental leave policy, for example, that a lot of states don't have, but it's not working as well as we need it to work yet. And so we also have to, from a say I'm a social innovation person, right? From an innovation perspective, we have to figure out why it's not and how to tweak it and how to make it work better. And I think there's a lot of opportunities for us to do that sort of at the positive, but then to really investigate what's happening on the ground and tweak it, right? So maybe we need job protection and associated with the paid parental leave in order for people to feel like they can afford to take that leave so that they have a job when they return, right? Things like that are keeping people from taking advantage of the resources that we do have, in addition to creating some more systems.
Yeah. I want to fold in another question here from our audience today, and I'm going to open this up to all of our panelists, whoever feels like chiming in, because it's a really big one. Plans to address the mental health aspect of women, single mothers, and children. This is a big issue, and the kids are suffering. Couldn't agree more. Who would like to take this one on? It's a big one. It's a tough one.
It's rough because even pre-pandemic, we did not adequately provide for mental health. And recognizing that it is a very legitimate healthcare need is first and foremost. And then recognizing that we need to expand it right now, especially because this pandemic has put everyone under stress, but it has put children and women under more stress, when women, just because of the reasons we've talked about, because they've lost their jobs in bigger numbers, because they've had more burden due to this domestic labor and such. All of those reasons. But I wanted to go back to a point that Christine made, which is around we're using a term now, the care economy or caring economy, a lot. And I don't mind it, but I think domestic labor is almost better, because I feel like when we're using caring, it's almost back to, oh, that's only for women. And that's an unfortunate judgment within our culture, which should be embraced about everyone, but it still kind of has that tinge. And when we think about part of the reason that domestic labor at home and such is not valued is because domestic labor, even that's paid, is undervalued. And Odilia's, many of the folks you're working with, Odilia, they're in the very lowest wage jobs, which are these service jobs, whether it's childcare or cleaning our houses or any number of other hotel work. And the fact that we allow that to be so low paid, it allows us also to not recognize that the labor at home has a value. So I think both of those things have to be fixed to come out of this and really bring the economic value to what we now know is, in large cases, women's work.
Odilia, do you want to jump in on that and talk a little bit about the women that you've been working with and whether they feel like maybe now that we've all been forced to do a lot more of this domestic labor, hopefully, is there any sense that will really bring up a sense of what this labor is worth and hopefully pay for it accordingly?
Well, it has been an ongoing issue, right? We are in the lowest, the underpaying jobs. Yeah. So currently, mental health is one of the things that has been brought up to CIELO. What do? We don't know how to help the kids because we are illiterate, some of us, right? How do we help the kids? Now they're falling behind more than ever because, again, we live in multiple families in one single home. This brings a lot of mental health issues. In the case of CIELO, we have a mental health program for our staff, that group of interpreters that we had. This was pre-pandemic because we knew it was a problem way before. But because we interpret of cases of people that have come through the bestia, that had been raped at the border, kids at detention center, the secondhand trauma that is inflicted in Indigenous interpreters, we were addressing that. But right now, for the rest of the community, we have no way. We're, again, underfunded. We have no way of supporting the families. One of the women, I'll share a quote that she had on the book. Before, we were used to, we were afraid of getting deported. Currently, we are afraid of losing our children to the system because they're not at the same level of their peers in school. We are afraid of who's going to take care of us if we catch COVID, who is going to take care of our kid, and who's going to bury us if we die.
Right.
You will see this quote on the book. This is what all the mental issues that Indigenous women and families are having currently. And we have no way of supporting. Again, we go back to this label. Everybody from south of the border is Mexican. Not true. Mexico has 68 indigenous nations and 18 languages are spoken in LA County alone, not to mention Northern California, right? Or throughout California or the US. And then we have the Guatemalan languages. There are 23 of them spoken. And they are also spoken here in LA County. There's no way CIELO could be able to help with this process, but it's it is a big challenge that we face at CIELO as Indigenous women leading this organization, because then there's also that hope from the community. Oh, there's an organization that is helping us. They already helped us here. They already show solidarity here. Maybe they will support us here too. And we don't have the capacity. We really don't. And it's heartbreaking. I wish we could, but we don't.
But I do feel like, or I hope on my more optimistic days, that seeing how much of a broken system this pandemic has revealed, because we are starting kind of in some ways at a new foundation, hopefully best case scenario, this pandemic will allow us to rebuild in a stronger, more equitable way. And Dee Dee Myers, I know that's been a big part of your role there in the governor's office. And this was also one of a question that we got from one of our attendees today. How can we create enough political power to make sure the recovery really addresses the underlying structural inequities that disadvantaged women face, especially women of color? How can we make sure we don't go back to normal, but instead move on to better? Dee Dee, how do you think we do that?
Yeah, no, it's a great question, and it's a long-term challenge, right? And in the first thing we have to do is continue to recognize the inequity that this pandemic has revealed and exacerbated. So today, the governor announced that we are changing our vaccine distribution formula to prioritize people in the most impacted communities. And so going forward, 40% of vaccines will be made available to people who live in the most economically disadvantaged communities by a series of metrics. And the idea behind that is to make sure that not just the front of the house is vaccinated when you go to a restaurant, but the back of the house, the people who are doing the work, the people who've been most impacted and burdened and sickened by the pandemic get vaccines, because that's the way to reopen the economy safely, get kids back in school safely, get people back to work safely. And that's so that people can go back about their lives. I mean, I think one of the things that I've been struck by in this conversation, both Professor Beckman and then I think Odilia, just is again, this part of the burden that's unnamed, right? Whether it's keeping track of the doctor's appointments or worrying about your child who's stressed or all the other things that are going on in the household that don't have a name to them. And we have to continue to name that and help address those burdens while rebuilding the economy in a way that's equitable. So first, we need equitable distribution of vaccines, and that's economic, but it's also, we know women are in those disproportionately impacted communities, so they will benefit from it, and as well as things like food and ag sector, right, which is prioritized, which is largely women working in those kinds of industries. And then going forward, we're going to have to find ways to help women get access to education, get access to capital, get support through the systems, whether it's childcare, healthcare, education, business support, to rebuild what will be, I don't know, a decade-long process of getting women back into the workforce. We know that just as we were heading into the pandemic, women reached 50% of the federal workforce. But in January, women lost 5 times as many jobs as men did. So we know the damage is long-term. It's going to take all of us getting together and working across multiple sectors and issues to put us back where we were a year ago.
And just to throw out another fun stat that I just saw the other day, some models estimating that employment for women may not recover to pre-pandemic levels until 2024. Anyone want to guess when they get back for men? A full 2 years earlier. And I have to think that one key aspect of that, like, is it going to be a full 2 years later or longer or shorter? I think some of that, and I'm hoping, Professor Beckman, maybe you could speak to this, has to do with job training. I mean, to Dee Dee's point, access to capital is huge, but if you don't know what to do with it, if we were to, you know, what Odilia was talking about, if women just only return to certain kinds of jobs, then I think equity is a much harder thing to think about. Professor Beckman, what do you think can and should be done when it comes to job training as we begin to kind of move out of this place that we've been in?
Yeah, so I actually have a short story on that. It's a great question. This is maybe more local than you were intending, but I heard a fascinating pilot just the other day that sort of around home care, child care providers in the home, right? So thinking about small businesses, this is that intersection of child care providers that are also helping people actually be in work that we talked about earlier. And sort of one of the challenges that Price Philanthropies and partners in San Diego realized is that they were getting licensed, but then not opening and not being successful, right? And the why not? As they did their research, they realized it's because they weren't educated. They didn't know how to run this as a business, how to market, how to think about all those operational issues. And so they started a pilot program to try and create that training for people trying to offer that kind of childcare in City Heights where they were operating, and trying to have cultural navigators to sort of help make sure that they were doing this in languages that people were speaking, right? Because these were often in people of color, and so a great example, I think, of how important training is, but also this goes back to my, like, we have to be paying attention at the ground to figure out, okay, what kind of training do we actually need, like, and then there's additional problems that then show up around. And how do we evaluate success? And is that going to be different across all of our different communities? So there's a lot of white assumptions around what quality looks like, for example, that may not be shared. And so the education has to be very sensitive to the kind of differences as well. So it's probably more narrow than you want, Alex, but I think it was a really hopeful example to me of the kind of really nuanced training that was happening in San Diego.
Yeah.
And
I want to.
We may
ahead,
need
Senator.
we may need to provide, we may need to recognize that this hit, because then more women out of the workforce, then obviously they're not contributing to Social Security or 401ks or various things like that. So then their retirement security is at risk and we live longer. So we may need to look at a direct compensation to make up for that. I mean, people don't always, that always sounds, from some people's point of view, like not a good thing. However, it may cost us a lot in other ways if we don't recognize that there is that economic hit. But I've been very heartened by, there's a lot of influencers that have been talking about this. You never want a crisis to go to waste. But for example, Charlize Theron, Julianne Moore, various others, they've been writing about how women and moms are the bedrock of society and they're tired of working for free. And Shonda Rhimes, for example, tweeted that she'd been homeschooling her 6-year-old and 8-year-old for just an hour. And she decided that teachers deserve to make $1 billion a year. So, it's great that we have many more influencers bringing these things to the fore to all of our attention.
That's so great. And I hate to be pessimistic, but, when I talk within my family about this pandemic, especially with my kids and my older kid for whom this has been tremendously difficult, and when I try to explain the concept of time and this too shall pass, what I talk about, which is what I know from my own experience, is the actual physical process of childbirth. And for any woman participating in this, I see Senator Skinner laughing there. I think you know where I'm going. At the time, it is such a strenuous, intense ordeal. You think that there is nothing in the world that would make you forget it, but you move a couple months, years down the road, and I think that there is a natural amnesia, because otherwise, as one friend of mine joked, like, we would never have a second child or a third or a fourth if we remembered how tough it can be to have that first one. That is one of my sincere concerns about this pandemic, is that it has ripped this giant, Band-Aid off. It's exposed so much inequities, but as we kind of turn the corner and things go back to whatever a new normal looks like, I worry that we will forget. We will forget what the worst of this looks like. And Odilia, maybe can you talk about how we make sure that all of the work that you, for example, done with CIELO, that this is something that we keep top of mind when we kind of go back to normal and kind of start to function on autopilot again?
Well, I agree with you. It's worrisome because everything you forget about it, right? You do like out of sight, out of mind kind of a thing. We don't see it anymore. We're gonna forget. And I'm worried. I'm worried. We already had many challenges as Indigenous people here. Just the lack of being recognized, and was already a challenge. And now we have this other layer, but also the multiple languages that are spoken is another layer, right? And then only 1% of Indigenous population has access to higher education in Mexico. So, those are the people that are migrating to the US. So they are the farm workers, the domestic workers. How are we gonna support them? How they don't have 401ks, they don't have savings, a lot of these things. How are we going to create and implement a path to be inclusive of Indigenous peoples, especially women? We need to invest in Indigenous organizations, just people of color, Black, Indigenous, Latinx, because we are, most of the time forgotten about, and we have been the most impacted. I live in South Central LA. I'm surprised that LAPD hasn't interrupted this conversation because they're constantly surrounding us. It's a good and bad thing. We have some issues in the neighborhood, so that how do we make sure like South Central is included in that recovery? The MacArthur Park in LA is included, and also like the farm workers across California. I just saw yesterday the government stat of the bodies repatriated to the state of Oaxaca, the state that I am. Most of them were farm workers.
Wow.
That were from Northern California, and some here in the restaurant industry, but the majority of the repatriated bodies were from farm workers. So and a lot of the women are farm workers. So how do we do that? I think one of the things we should do and not forget is they are essential workers. They have always been and will continue to be essential workers. And also, how do we are inclusive, that we make sure that now that Senator is here, is like, how do we implement policies that protect their labor rights? How do we create videos about their labor rights, their human rights, their language rights? And how do we invest in a literacy program that they also could learn how to read, the ones that don't know how to read and write, and be able to move, have mobility while living here, right? So there's a few plans, but for us, we're going to continue working very hard and do our best ways of fundraising and providing as much as we can. And we do have a program, which is the interpreters program, where we're training the language speakers to become interpreter. They have weekly trainings, they're bilingual. So the interpreting profession is a very good paying profession. So that's already a step. We have a network of 200 interpreters that we're training, but that's just one program, right? We need a lot more programs like that for Indigenous people, Black people, Latinx, that we need, and we need support of the senators, the mayors to move forward with this,
Senator Skinner, do you care to respond to that and talk a little bit about some of the legislation that you've been working on and your colleagues have been working on to try to bring up equity here as we rebuild?
Certainly. We just approved it's, I'm going to describe it. I'm very proud that we did it, but it's not enough. But we did just approve $25 million for, it's called Homes for the Harvest. And it's recognizing the fact that our farm workers are migrant, and very often they don't even have a place to live. And how can you protect yourself from COVID if you can't shelter or quarantine if you're exposed? So we did just approve an early action on the budget, and the governor brought that forward to us, and we proudly approved that. And we have over the years been expanding the labor rights of farm workers, recognizing they are essential workers. We are all dependent on them. And their conditions, their work conditions are not good. And they don't always have even when we have done a better job in terms of providing more legal rights to them, they aren't often aware of it. And so sometimes their employer, can take advantage of that fact. And because of either language difficulties or others. And I think Odilia's point that it's not enough just to put the materials in Spanish, because there are so many different languages. But fortunately, there are good organizations like Odilia's and others who are working with our farm workers to help. And we fund many of those organizations to help farm workers know their rights and to represent them, to give them legal services when they're confronted with the circumstance that they've been taken advantage of.
I want to move to another one of our audience questions, and perhaps you, Senator Dee Dee Myers, might be able to take this one on. Teachers have suffered greatly being forced to provide all materials, equipment, and supplies to continue teaching with no assistance from their institutions. The CARES money and other funds have gone directly to students, or administrators have given themselves large raises. Will we see legislation that places funds directly in the class or provided directly to teachers? Might there be an option for teachers to get a tax deduction for what they've spent during this time?
Senator, I don't know if there's legislation to address that, or if it was in the legislation that I believe you guys are passing or have passed today.
Well, there was funding for what we call learning loss, where even with our classrooms reopened and in-person instruction, there's still going to be children who don't go back to school or that fall behind. And of course, the burden is on the teachers. So there is money there for example, tutoring, for extended things. Now, that doesn't necessarily address the questioner's question, which is, what about the money she's put out herself? And I'm assuming it's a she, even though we do have men teachers also, but dominantly women, that she's put out to buy supplies, to do other things for her students, which we hear about all the time. But we are funding education better. We've historically been very low in terms of the rank of states, but we're in much better shape now. And fortunately, most of our schools, the teachers are represented by very good unions, and they fight to make sure that teachers are not having to, but are minimally having to use their own dollars to buy supplies for their students. But it is something that we'll have to look at. So I thank her for the question, and we will look at that.
Yeah, I would love to maybe put this one to Professor Beckman. In what ways do you think guaranteed income programs can play a role in creating economic recovery or a safety net to ensure that women can find economic stability? And interesting to note, this is something that female Mayor Asia Brown in Compton has been doing. Professor Beckman, any thoughts on guaranteed income programs?
I think they are really interesting experiments. I mean, I think in Stockton as well, looking at sort of the trying things out, seeing what works, sort of iterating and trying to improve and scale. I think that's what we need to be doing, is sort of doing that at a local level. In addition to that, I think another thing we could think about, thinking about the domestic labor and the caregiving work, is giving families money to pay for that work, and whether that's could be paid for by someone in the home, a family member doing it. It could be a child care provider. It could be, but I think we can also think about sort of giving people income for targeted for all of this kind of work that we have been talking about. And that would be one way to make it more valued and more valuable, if we were actually explicitly helping people pay for it.
Yeah. And Dee Dee Myers, do you want to chime in on that too? Because it's an interesting social experiment that we're starting to see happening in certain places in California.
Yeah, no, it's definitely something that the governor's interested in. And there have been experiments, as pointed out, in Compton, certainly famously in Stockton, other places around the country. Mostly it's been funded so far by philanthropic dollars, interestingly. The question is, do we want to put some state resources into that, piloting programs to see if you provide a minimum level of income, how much stress does that relieve? How much, obviously will help people from tipping over the edge into homelessness, losing their cars, all the things that take many years to rebuild, as opposed to just having a period where they may be unemployed or have unexpected expenses or something. So it's a very interesting experiment, and I think something that we're going to see more of, and we'll evaluate the results and see how we can maybe scale that in ways maybe targeted toward things like childcare, as Professor Beckman suggested, or not. But can I just make one other point before we run out of time, which is one of the things as women we need to continue to do is drive more women into positions of decision-making. Senator Skinner, Professor Beckman, people at all levels of government and industry, to make sure that those problems, that Odilia isn't having to continue to raise, although she will, the plight of Indigenous people or of women who are unemployed. But so doing things like requiring, as California recently did, that there be women on all boards of companies based in California. So a woman in the board, and being on a private sector board, it makes an enormous difference, right? And doing, the first partner has driven a thing, a pay equity pledge to try to get companies to pledge to equal pay, making sure that those issues get elevated and that people who have visibility into them are at the highest level, so that we can continue to make sure the burden of keeping this conversation alive doesn't just fall on the people who are already most burdened.
Yeah. And I'd like to think that many other, that your point before, Alex, about, will we keep these things on the floor, or will we get the amnesia? It will fall on us as women to make sure that that we don't get the amnesia. And of course, to Dee Dee's point, the more of us women are in positions, in roles that can affect it, the better. But just quickly, this is a great opportunity. While California does not statewide have the kind of a program that Stockton had, something that just provides a payment to everyone, we do have the Earned Income Tax Credit. So there's always been a federal one, but California has its own. And this is a great opportunity to raise this for the listeners, because in addition to the small business expansion, the grants that Dee Dee raised, the governor also greatly expanded, just in an action we took a week ago, where everyone who qualifies for the Earned Income Tax Credit. And when I say that, the notion of just providing people a basic income, the Earned Income Tax Credit is close, because you only need to have a wage over a year, even of just $5. So you don't have to have worked regularly. In other words, you could have been in a circumstance where your job was just intermittent. Yet the Earned Income Tax Credit in California will be given to you. And we just gave $600 additional, in effect, a stimulus of $600 to all the families who are eligible for it. So if you know anyone who's eligible, make sure they apply for their taxes early, and they will get that special stimulus from California.
Thank you, Senator Skinner. We just have about a minute left on the clock, and women know how to run meetings and do meetings, so I'm going to end us on our Family Feud note. I would love to go around and have each of us share one word, one trait, one quality that you think we as women have that will best get us through this moment and into a better future. I'm going to start and say women are agile. Odilia, what is one trait of women that you think will help us get through this?
We are, I can never pronounce it, persistent. Persistent. We're like, they're knocking the door and never stop knocking, right? Until we get a yes.
Love it. Professor Beckman, how about you?
I was going to go with persistent as well. I agree with Odilia.
And all right, let's turn it over to Dee Dee Myers, a trait of women that will get us through.
Resilience. I think it's similar to persistence, but resilience. We get up and we keep going.
Indeed, we do. Senator Skinner, the last word of today's seminar, what will it be?
We're fighters.
What a proper word. This is a USC event, so fight on we will, fight on we shall. I want to thank everyone, all of my panelists today. So much really helpful, valuable information and perspective. My thanks to USC as well for inviting me today. And that concludes our seminar. Thanks so much.